The treatment of anorexia is very difficult. Let me start off by saying that. It can be treated. Patients can get over it. Patients can actually thrive after treatment for anorexia. But it can be a very difficult and frustrating condition to treat. Sometimes patients are at the brink of death, and they still will not stop their behavior. And you can show them their laboratory tests and their EKGs, which all show difficulty, and yet it's like it doesn't register. They can't seem to stop. So part of the problem is a difficulty in treating the condition itself. The other part of the problem is the relapse rate amongst patients with eating disorders, especially anorexia, can be extremely high. And it may require treatment again and again and again. And part of the difficulty, to be very honest, is that many insurance companies will not pay for repeated treatments of eating disorders. Some won't even pay for the initial treatment. And many of the public health system mental health treatment facilities don't do a very good job in patients with eating disorders. Treating an eating disorder, especially like anorexia, requires a lot of time and a lot of patience and a lot of intensive therapy, which many public sector programs just don't do well with. And so treatment of a loved one, of a family member, of a patient with an eating disorder can be a very frustrating experience. On the other hand, let me conclude with saying that it can be treated and patients can go on to live normal, successful, fruitful lives.